Welcome back to our next panel, Science Advice During COVID-19, What Factors Made the Difference? This session will be an opportunity to review some of the standout lessons and case studies from the various players at the front line of synthesizing evidence for advice or that have been tracking the policy responses around the world. Please welcome our panelists, Stephen Quest, Director General of the European Commission's Joint Research Center, Yuxi Zhang, Postdoctoral Research Fellow at the Blavatnik School of Government at the University of Oxford, Amadou Sall, Director of the Pasteur Institute of Dakar, Inaya Rakhmani, Director of the Asia Research Center at Universitas, Indonesia, Romain Murenzi, Executive Director of the World Academy of Sciences, will be moderating this session. Up to you, Professor Murenzi.
Again, I would like to welcome you to this session on science advice during COVID-19. What factors made the difference? Here we have 4 speakers, and I would like to start with Stephen Quest. Stephen Quest is the European Commission Director General of the Joint Research Center as of May 2020 in Ispra, Italy. Prior to this, he was Director General of the Director General for Taxation, Custom Union, and the Director General for Informatics, driving the digital transformation of the Commission. His career spans over more than 25 years in the European civil service and has included work on the EU budget, social and environmental policy, and 4 years as Assistant to the Secretary General. As the Director General, 7 is particularly focused on modernizing the organizational structure and promoting innovation within the Commission. So, Stephen, we'd like to hear about you. You gave a think piece. Can you spend 3 minutes in expanding on it in relation to the subject?
Yeah, with pleasure. Thanks, and welcome to everybody. Thanks for joining this session. So obviously this pandemic has really put science in the spotlight and put us all under pressure in the scientific community to find this balance between speed and quality of science. I think maybe, 3 things we've learned on the challenges side of the equation is firstly, the challenge of finding comparable data and getting hold of data that we can actually use. So I think there's been a data challenge and that remains high on the list. There's been a challenge in managing misinformation and disinformation, which I think has made the response to the pandemic and relationship with citizens really particularly challenging. And I think there have been challenges as well in ensuring coordination and connection between different systems. And if I look at the European arena, where we have activity at European Union level, but also at member state level, at regional level, and we're working as well with international organizations, ensuring that coordination and that connectivity between a wide variety of agencies has been challenging, and I think there's ways in which we can improve that. But if I look now at what we've learned in terms of on the opportunity side of the equation, and perhaps another 3 messages that I tried to weave into the think piece that we shared. The first, I think the strapline would be that the pandemic has also given us the possibility to have a new momentum for science advice and to build better bridges between science advice and policy. So we can see in amongst all the difficulty of the pandemic, there's an opportunity for us there to position the work of science and in support to policy. And so first message would be around the opportunity for more joined up approaches and bringing together different branches of science in support to the policy response to the pandemic. So everything from work on epidemiology, but also economic responses, behavioral responses, and so on and so forth. So I think that's one strong message that comes through for us in the Joint Research Center. A second opportunity is around reinforcing and building connectivity between different poles of scientific activity. So we work quite closely, as I mentioned, with our member states in the European Union, but also down to regional level and right up to international level. And that connectivity, I think, is absolutely fundamental. And then a final challenge and opportunity for us is I think building trust with citizens and how to ensure that the scientific work that's being done by our experts is understood and is trusted by citizens in this world where it's so easy to spread misinformation and disinformation. So those are just a few headlines thoughts. I know you want to keep this short at the beginning, so I'll stop there if that's okay, and pass on to the other panelists.
Thank you very much. Thank you very much. I know JRC really play almost the role of the science advice for the European Union. So we will hear later about that. So Yuxi Zhang is a postdoctoral research fellow at the Blavatnik School of Government, University of Oxford. She's currently leading the Oxford COVID-19 government response trackers effort to collect subnational data for China. She's also conducting a project to assess the UK government's implementation value for money recommendation made by the Parliament. So, Yuxi, to you.
Thank you, Chair, and thanks for this great opportunity to speak on behalf of the Oxford COVID-19 government response tracker. Just a bit of background information of what we are doing. We share in the think piece that this is a project really spring out from the student seminar room and into a project that is contributed by more than 600 volunteers worldwide. And so what we have been doing is we are working hard on putting up a global panel dataset to track government policy responses to COVID-19 in almost all countries. And the domain we track including closure and containment, economic support, and public health policies. And recently we have been building up the vaccine indicators. And so, in our think piece, we have shared a few points where we think giving scientific advice during a pandemic has been challenging, but what we have been doing in order to, sort of do a little bit better. I think the first point I want to make is building up a data set that is global coverage and is of the great value and potential, but also very challenging. Because when you are really collecting data on local reality, you're not just trying to tell people, okay, there is a curfew, but you're trying to help researchers and policymakers to understand why and what is happening on the ground. For example, we have been struggling a little bit to understand why some African countries have installed a curfew after midnight. And then it was actually our volunteers who live in those countries help us to understand how recreational activities and sort of social gathering and that they are actually sort of following a different pattern as we have in the global north. And I think this echoes Stephen's point quite well, that we really need to combine different disciplinary approach to understand, to make our information really useful. And secondly, the challenge is the pandemic is really evolving, and we have to constantly answer to the information gap. For example, we need to bring in, how vaccine is distributed across countries, and how, sort of natural flow test is brought into many countries, surveillance system, which was not in place when the pandemic first hit. So given the time, I will probably stop here, but I think in the following discussion, we will have a lot I know we will share a lot of common interest and questions with other panelists. I look forward to that. Thank you.
Thank you very much. Thank you very much. The issue of data collection, data protection, these things are very important. And I didn't see Amadou Alfasal. Is he here? We didn't see him, so yeah. So, now I'm going to Dr. Inaya Rakhmani, is director of the Asia Research Center of the University of Indonesia and the deputy director of the Science and Education Working Group of the Indonesian Young Academy of Sciences. Her research interest is grounded on the concern regarding how culture can hinder and enable redistribution of wealth. She's the author of Mainstreaming Islam in Indonesia, published by Palgrave. But you can read her bio in detail on the internet. So Inaya, to you, 3 minutes.
Thank you, Romain, also to other esteemed speakers. Very happy to be here. My think piece was based on an 11-country study jointly carried out by the Asia Research Center, which I direct, and the Global Development Network. It's funded by IDRC and it spans across Southeast Asia and Asia. One of the main themes across these very different countries, not only across countries, but also within each countries, are how the pandemic has exacerbated social inequalities. So pre-existing social inequalities, hindrances to access to health services, social services has been worsened during the pandemic. And this is also made worse by the kind of disciplines that are privileged to be heard and linked with policymaking in different countries and regions within countries. There is privileging of health sciences and hard sciences that can be generalized, and there is a marginalization of social sciences, borrowing Yuxi's term, is actually on the ground. I'll return to this point at the end of my short presentation. Likewise, these social inequalities can be seen along lines of race, religion, ethnic groups, gender, and class, which are already marginalized even before the pandemic. These play along the lines of majority and minority groups, and especially in the case of minority groups, which we speak about groups who don't have a voice, especially so during moments of crisis, can only be studied with immersive, ethnographically inspired data collection. The lesson learned that can be studied across these countries are social resilience on the ground that is actually apparent across countries happen outside of state intervention, outside of state policies, and outside of the more formal links between science academies, universities, and policy making. This can be seen in at least 3 countries, Indonesia, Malaysia, and the Philippines, in which social scientists and academics, and as well as communities, work together to create everyday pantries, to create everyday health access that cannot be provided directly by the state up to a granular village level. And notably, they can do this because they don't rely on the state's intervention to provide those services to people who need it the most. What's important to underline here is the fact that these resilience occur in spite of the presence of the state, which means that if we think about connection between science and policymaking, we need to think about what kind of sciences are we mainstreaming into policymaking, as well as how we can learn from these lessons on the ground in which people, ordinary people and academics without funding are actually moving resources to protect the most vulnerable. I'd like to end this note by returning to the initial point I tried to make, which is existing inequalities between disciplines, paradigms, and approaches that are currently being listened to by policymakers, and the types of qualitative, long-term, really deep research that listens into the nuances of everyday communities that needs to be more present in policy discussions. Thank you very much. I return the floor to the chair. Thank you.
Thank you very much. Thank you very much. I would like to ask Alex, is there any question to any of the panelists at this time? Hi, Alex.
No question received. And so I'd like to remind people that they can use the submit question function, and we'll be able to channel that through the discussion. Thanks.
Okay, thank you very much. Thank you. Steven, in your think piece, you refer to some of the challenges that have to be faced during the COVID-19 pandemic, in particular one the lack of reliable data to coordinate and compare responses between countries. 2, the difficulty to communicate to the public evolving policies. And 3, the proliferation of misinformation. You just mentioned it, communicating the science behind the decision, making even more difficult. So what is today's status of these 3 particular challenges? Has there been any progress, setback, or both?
Well, thanks, Romain. I think we certainly can't cry victory on that, but we've been working hard on it. I think on the data piece, certainly within the European Union arena, we've made some progress in both helping to join up the data, get access to the data more rapidly, and certainly in the Joint Research Centre, we've been working quite hard to get access to new and different forms of data. Just to give you one example, we've been working with mobile phone companies to be able to get access to their data so that we can track mobility patterns of citizens and map that against and use that as part of our modeling in terms of the way the health situation is going, and that actually is providing some quite useful insights in terms of the way the virus is spreading. I mean, the other areas, I mean, tackling misinformation, disinformation is a major challenge, I think, for all of our societies. I think certainly the awareness of the challenge, I would say, has risen significantly in the policy and in the political sphere, and the European Commission has been quite proactive in putting out an action plan to try and tackle that. But it requires cooperation between a wide variety of actors. It requires, perhaps action at government level, but also cooperation with the media players, with advertisers, with the platforms, and with regional and local authorities as well. So what we're trying to do is to, on the one hand, raise awareness, and on the other hand, ensure that different elements of the toolkit that you might need to deal with this problem, whether it's regulatory action or educational action, are either being proposed or being encouraged. But I'd say that on misinformation, disinformation, it's going to be a long haul, but that we have to remain very vigilant, because I mean, even for this pandemic, we're still far from out of the difficult water, and we see a lot of I mean, one other thing to mention, and then I'll stop to give the other panelists a chance to come in. But one thing that we do as well in the Joint Research Centre is actually to monitor what's happening in the media, and so we do a very active monitoring of misinformation and disinformation, and we flag that very rapidly and very proactively to the policy teams so that they can craft policy responses or communication responses so that they can react in real time, because we can see what's happening as we scrape the different media flows, and we identify disinformation. So we're trying some of these different techniques. It's work in progress, and hopefully we'll see some positive results from this in the months ahead. Back to you.
Yes. Can you comment a little bit in terms of supporting developing countries for collecting data? Is anything that could be done in that regard? I remember I have with me here an atlas for Africa that we produced by JRC. Can you do the same for health on viruses and things like that for like for the continent of Africa or the global South in general?
Yeah, well, it's great that you got one of our atlases, and we're very proud of these atlases, and we produce quite a wide variety of different atlases, and they're not just European focused. I mean, we use a lot of the new data we're getting, for example, from the Copernicus system. We use that to feed into our models and provide information. So, I mean, I think on the one hand, the models that we build are certainly things that can be used and powered by data from other parts of the world as well. So we don't just want to keep this stuff secret in the European Union. We're very happy to share that, and we have a wide variety of cooperation with a wide variety of developing countries right across the world. I mean, on the pandemic for sure, but also in a wide variety of other areas. I mean, a fairly deep cooperation between the JRC and Africa, including on issues such as water and soil and biodiversity as well. And so I think it's certainly the cooperation, for example, between the European Union and Africa is one of one of the president of the Commission's priorities, and it's something that we're very mobilized on. Yeah, absolutely.
So thank you very much. Is there, Alex, any question came out from the on the chat or?
Yeah, one just came in about recognizing that COVID-19 may have been a blessing in disguise in some way for scientists and science advisors. And so the question was asking about if the science for policy or policy for science was up to the challenge.
Could you, Stephen, can you comment on that? For the other ones, I'll have an opportunity to do the same. Can you comment on that?
Yeah, with pleasure, thanks. I mean, I think, you know, certainly we said a lot in the course of the last 18 months that this is the moment of science, and it's a moment when science is really in the forefront. I mean, I wouldn't personally call it a blessing, but at least, you know, COVID a blessing. But I think it does present an opportunity for us to reinforce some of these messages, and to, I mean, the risk that I see is that, you know, we mobilize science to do with the pandemic, and then we go back to the old way of doing things. What we need to do is leverage what we've learned through the pandemic to be better prepared for the future, to have a more anticipative culture, to ensure this connectivity between science and policy, to ensure that we have these multidisciplinary approaches, and that we really root this in to our way of doing policy in the future. Now, I'm reasonably optimistic that we can maintain this momentum and learn some of these lessons, but we should not take it for granted. So I think it's going to take quite resolute action on the part both of the scientific community and the policy community if we want to lock in and anchor these benefits going forward. I would also say that there's a potential downside risk for us, which is that, okay, science is in the spotlight, but people increasingly want science to give instant answers, and there's a real trade-off between speed and quality, which I think needs to preoccupy us all, because we have to absolutely maintain the integrity of science and scientific excellence, and we can't necessarily do that at the drop of a hat, and that tension is something that is extremely present, and of course we need to be responsive, and we need to deploy all the expertise and knowledge that we have as rapidly as possible, but we also need to be honest sometimes in saying, well, there are some things that we still don't know and we still need to work on, rather than pretending or allowing the pretense to emerge that we have better answers than we're able to have given the state of knowledge or the state of data that we have.
Thank you very much. Yuxi, as an expert in tracking emerging policies to provide data that are comparable and straightforward, simple and rich at the same time, you mentioned in your think piece that researchers have to utilize multiple dissemination methods to achieve effective communication with data users. Could you please elaborate on those multiple dissemination methods? And yeah.
Thank you, Romain. So yeah, so we are mainly putting up a sort of global panel dataset, which is used widely in modeling studies and by quantitative scientists. But I think along the way, a year and sort of half, we think, especially when we're trying to make recommendations to policymakers and, you know, the sort of broad audience, including the public, you know, not everyone is very familiarized with quantitative science, and our partnership with Our World in Data by University of Oxford is a very useful tool to visualize the changing in sort of global, like, countries' policy responses to COVID-19. Meanwhile, we have been publishing regional report in which we use very simple one paragraph text to summarize what is happening on the ground. And it has certain audience group. And at the same time, in our collaboration with UK Cabinet Office, we yearly feed them with information on the key country groups, but also commissioned by them to have a deep dive into certain policy topics, which is kind of similar in our partnership with INGSA. And when we work for the IPO, International Public Policy Observatory, we usually sort of do a bit of deep dive into topics such as sort of the mental health services for young adults, or sort of targeted support for young adults during COVID-19. This kind of thing we do not usually track in our ordinary system, but whenever we find if we are asked about the information, or we find there is a information gap, we leverage a variety of partnership and sort of format to try to come up with information that might be useful for various data users and the society as a whole. Thank you.
Thank you very much. Thank you. Of course, the issue of data collection, I think, or users and the right to use the data, the privacy, those issues are very important. Is there Alex, is there any question on?
Yes, so someone is asking Dr. Rakhmani to elaborate on her comments about areas of science which are not mainstream and which are not informing science advice, and asking especially for examples.
Yuxi, to you?
I think the question is for Inaya, isn't it?
Yeah, okay. Then I will. If you wanted to comment, you could have commented, but it is okay. So we will respond to the question later after she. So Inaya, in your think piece, you stated that the current COVID-19 crisis in Southeast Asia is a social issue that took the form of a health crisis, and that in unequal prioritization is being given to health policy responses rather than analyzing such causes of the crisis as the difficulty to restrain mobility in some areas. Could you please expand on the concept?
Yeah, thank you. Maybe this could also address the question that was given to me. Yeah. Those especially vital workers of the lower classes across countries and regions cannot afford to actually be restricted in their mobility. These include sanitary workers, domestic workers, health professionals, etc. Even before the pandemic, they were already vulnerable and already precarious because they are usually casual workers. And with the pandemic, especially in countries where state responses has been uneven, in which perhaps local provinces, local governments and states are responding to community crises much more effectively than the state, there is a closer connection between policymakers on the local level, whether village, provincial, or regency, with those actually mobilizing resources on the field. This way, several areas can be on lockdown based on community initiatives, much faster than the top-down approach that the national government can provide up to a village level. When I say that these kinds of research, mapping which kinds of communities are actually finding ways, innovative ways to self-organize, when they're marginalized, I do not mean that epidemiology or public health are less important. What I mean by mainstreaming is that giving insights into the pockets of the regions, pockets of rural areas, and also peri-urban areas in which vital workers are actually the highest in amount, alongside the kind of large-scale surveys that inform policymaking and health policies in a macro way. These both approaches converse with each other, needs to converse with each other and complete each other in terms of informing policymaking. So I hope that addresses the question given to me. Over to you again, Romain. Thank you.
Thank you very much. Thank you very much. Alex, is there any question around?
So someone has been asking about traditional knowledge and how that may have played in the current pandemic and how we dealt with it.
Is there anybody wants to respond to that question?
Yes, if I may, Romain.
Yes, please.
Yes, as in the case of Indonesia, I think it applies as well in Philippines and Thailand. There are some herbal medicines that were trusted by certain ethnic groups to increase immunity. As it spread, the use spread popularly among rural communities and also small pockets in urban areas because medicine is not yet widely available, as in the case of wide vaccination. Such approaches can be useful, but not as a main solution. The way traditional knowledge helps bind together communities, otherwise having very low access to modern health services, go alongside the kind of support system needed, because many of those using don't have legal documents and insurance, state insurance or country national insurance to cover their vaccination costs and if they are hospitalized. So not to say that traditional knowledge is not important, it actually provides the kind of social safety net that is required in areas that the state or national health policy making cannot reach yet. But it should not substitute the kind of health services. In this case, for example, vaccination, it should be publicly available. It should not cost a thing because it only works when portions of the population have been vaccinated. So that's a bit of insight from the country studies in Southeast Asia. Thank you, Romain.
Thank you very much. So come back to the issue of traditional knowledge, what is also called indigenous knowledge throughout, for example, the South, and how do you use citizen science? How do you involve the scientists, the citizens in decision making, in data collection, in involving them? Because the COVID-19 is not just about the scientists, not about the policymakers, it's about the citizens. So on the panel, of course, we have we have Europe, and then we have Asia. Myself, I come from Africa, so I could comment on that. Can you really comment on citizen science, how to involve the citizens, the issue of data collection? Yeah, so that will be very important too. So I will start by Yuxi.
I think I can probably share a few thoughts on this question. So we are really building on the effort from a global community of volunteers, most of whom are students or researchers based in almost all continents in the world. And so I think their insights, obviously their language skills, their insights about local reality, and also their passion for let the world know about the situation happening on the ground, is the energy which really keeps this project going. For example, taking my experience as a captain of the subnational China data collection team, I'm organizing roughly 60 Chinese students who are based in China to collect the provincial level policies in China, just to offer a bit more granularity and it sort of to facilitate subnational comparison and comparative study in China. And so we initially wanted to give students this rotation so they can have a bit of understanding of each provinces a bit better. But in the end, we find what works best is students, they really want to serve their own community. They want to get the experts and researchers to know what might be China's specific policies. For example, why China is vaccinating highly mobile young people instead of elderly people first. And it's under the background that China has largely controlled the widespread community transmission, but also like the Chinese economic activities has resumed, and the young people is the most mobile population group, and therefore they carry the largest risk of transmitting virus. So students have spent a lot of time, they want to make the world, help the world, or sort of people outside China to understand what is happening here and what's the rationale. I think this sort of bear in mind policy ownership and ownership of knowledge to people, to citizens who is actually contributing to our project and the data collection is a very important thing. And that is something keeps them feel involved and feel their work is worthy doing. Thank you.
Thank you very much. So I don't know how are we doing in terms of time-wise, Alex?
10:41 left.
How many minutes do we have?
10 minutes.
10 minutes left. So as you all know, science advice requires data, and data is very important, not only analyzing data, but collecting data. Also, for example, in the case of the vaccine here, doing a clinical trial. This means really collecting data on the health of people, so the issue of data protection is something that is very important. The issue of privacy is very important. So how do you link the issue of science advice as it related to data and data protection of the citizen? So I would like to, if I could have a comment on each of you, I'll be very pleased. So I can start with Stephen.
Yes, well, thanks. I think, yeah, very important issue, and obviously a very sensitive one, because on the one hand, as you rightly say, we need this data in order to do the scientific work that we want to do, but we also need to respect the right to privacy and to protect people's data. Within the European Union framework, we have a very, I would say, strict data protection regulatory framework, which by law we are required to comply with. So I think, I mean, the short answer, I mean, so for us, therefore, within the European space, it's an absolute. We have to comply with those requirements, and we have to ensure that our data collection, our data use, and our data reuse are compatible with those regulations. That can at times make life complicated for the scientists, but I mean, it's a trade-off that I think is necessary if we're going to have the trust of citizens, because I mean, we are also collectively collecting more and more data. So I mean, this is great because we can crunch data together, and we can also look to mix different types of data. I was mentioning earlier mobility data. Of course, all of this is anonymized, and it is in full compliance with the data protection regulation. But the more we want to mix different types of data, the more careful we need to be in terms of still meeting our regulatory obligations. So I'd say it's a trade-off, and it's not actually easy or necessarily. It doesn't necessarily make the life of the scientists easier, but I think it's necessary that we do it if we want to maintain citizens' trust.
Thank you very much. I see that we have 4 minutes left. Probably is anyone want to comment on that almost very last question before I? So if there is no comment on that, so Alex tells me that there is only 4 minutes. Alex, is there any other question?
Nope, we've gone through all of them, and so feel free to conclude as you see fit.
Yeah, thank you very much. Thank you very much. I think the COVID-19 showed us the centrality of science advice. The INGSA was established or founded in New Zealand, in Auckland in 2014, I believe. And at the time when Professor Rakhmani was talking about it, and I had been Minister of Science for my country, and So I was invited there, and I thought it was important, but probably we thought it was very important only for developed countries. I didn't really see much of the science advice in the developing world. But the COVID-19 has brought the centrality, has made the science advice to be center of governance. And so what is happening with the COVID-19, with the climate change, with biodiversity loss, water, access to water, I think science is at the center of all these issues. So we see science advice and science policy. We have to link together, and science policy and governance of natural resources of countries. Environment was left in the past to NGOs. They will say these are NGOs as they're just talking about environment, but environment becomes at the center of the life on Earth as we live it. So I'd like just to conclude to say thank you all for your presentation. And so we see that we have a long way to go. Countries from OECD or more advanced countries in economics and science, they have really science advice. They have building model systems. They have academies that are functioning very well. They have science councils. So we would like to be able to see in this science advice conference to come up with some kind of blueprint for a science advice at the global level, because science is at the center of advising government and governance. To you, Alex.
Many thanks to our panelists and moderator for this fascinating panel. This year, INGSA has added a new component to the conference, the digital posters, to showcase the new research and innovation taking place in science advice and science diplomacy. You can visit the tab on the left menu, and we encourage you to click on the heart button and comment on the digital posters that you enjoyed. INGSA will be handing out several awards for the best posters, including a People's Choice Award for the contribution that receives the most likes and engagement. These will be given out during the last plenary on September 1st. We would like to thank the official partner of the digital posters, the International Development Research Center. We will be back after the break with two very special sessions happening simultaneously, a keynote Q&A and a special event panel with chief science advisors from around the world.